I would like to invite Dr. Chanjiv. Dr. Chanjiv Mehta is a plastic surgeon serving as the Additional Director General of Health in the Punjab government. He's also worked with MSF a number of times and now serves on the board of MSF SARA. So, welcome, Chanjiv.
Thank you. We have some videos. Can you help me with that? Ollie, can you put those videos on? Okay. So we don't start them now. I'll just pause it. Right. Okay. So at the outset, this has been a very, very heavy day. I thank all the participants of this year's MSF Scientific Days around the world. And launched in 2004 in London. We now have a much wider platform through MSF Southern Africa and South Asia. So South Asia has been doing this for the last 4 years now. And we are connecting to audiences of medical professionals, health providers, NGOs, and others across countries, organizations, specialists, and disciplines. So I hope we still have an online audience like they just checked, because the organizers have advised me to run some videos through this closing remarks, so it's become more of a presentation now. Right. So at the end, we will look at a video of autos being used in Nigeria. And this is actually to reach out to the patients, and this highlights how MSF is innovating to provide medical care in crisis and emergency settings. So you all also saw today the innovative presentation just now, friend, on smartphone-based real-time medicine amongst this day of fantastic scientific presentations of practically and technically challenging work executed by the MSF. Well, this is really nice. My thanks to all the presenters who have made this program possible, really. Thank you so much. And my special thanks to the keynote speakers of today. The importance of MSF Scientific Days lies in reaching out to audiences which help guide our field operations, influence policy, ultimately improve the quality of care we provide for our patients. These discussions and debates have become all the more important as we are in the age of adaptation to climate change and other factors which are influencing health as well as our medical response to that. So SARA has been supporting MSF Scientific Days since the inception. So let's have a look at a video from our region about the Rohingyas. We did hear something about it in the beginning, and let's have a look at this video now. Can we see that? Yeah. Sound.
Who got a club foot. This is a deformity of the foot which makes it difficult for him to walk, and he had this since childhood. Unfortunately, when the soldiers came, his family couldn't take him with them. He was left in the house, and the soldiers found him there. They took him outside, and he told me that they shot him in his club foot. They chose the weakest part of him to hurt, to damage. And that, to me, it felt like some kind of horror. As it was, we managed to fix the guy's foot, and his club foot remains, but the bullet wound was successfully treated, and he's back to how he was before he was shot by the bullet. I can't see inside the mind of the soldier that did that. You walk maybe 2-3 kilometers through muddy roads which are actually rivers, and the effluent in the rivers is not savory, I can tell you. So you're walking through crap and pee, and you eventually get to some place where you have to hack back some vegetation. If you're lucky, you'll be close to an MSF borehole where you'll have water, be able to pump You'll be able to go to the toilet in an MSF pit latrine, which is separated far enough from the borehole so it won't contaminate. Schooling won't be possible for your children just yet. We had an excellent psychologist who worked there, and she used to deal with the children. And the children were often just, they couldn't speak. And the things that the children drew were the most horrific I've ever seen. Helicopter gunships. How can a child aged 4 or 5 know what a helicopter gunship is if they haven't seen one in the flesh? Raining down fire onto villages, onto houses. Their father being shot by soldiers. And these things, how these children could have that in their minds.
Farawati baran elang ele gorir sadde tarare edurmaya argortis satkide tar edurma bihede gorir mari di bagunu mari bihede wale gudi saria edurma argortu ye agorti sadde gori anta arianto mari wale mane bagu mari gor pura wale to barmata ha bole dunali hai eduriati bina sore sati far sati ya sati ki sore sati ki dekhiye manush Ma ba nan mar bazian bayar huan dan bosor huan bonur huan dan bagun mari kisna in sultula de kisna rakhia.
This is really touching. Sara wrote about the Rohingya issue to the OCA way back, and no, we don't start this yet, please. Yeah. Recently, the SARA board met in Dhaka and was updated about the ops in Bangladesh. And you know, this recent weather of rain and torrential rain, you saw in the video that these huts are being built on mud hills. So they cause to landslides and further add to the misery of this hellhole. Well, terrible. So MSF started a Hep C project in the Manipur project. And after that, we had an Explo in Punjab with private players and the government. So highlighting this issue led to at least the Punjab government starting a project to provide free Hep C medication in the state, so we didn't have to really go in there. So after that, we took up a Explo in UP. I think Stobden helped with that. And let's have a look at another video on Hep C, the project in UP.
Excellent psychologist, back some vegetation. If you're lucky, you'll be close to she used to deal with the children, and she used to deal with the children, and the children were often just, they couldn't speak. And the things that the children drew were the most horrific. These things, how these children could have that in their minds.
When we started the clinic here, the response from the population was overwhelming, and too many patients were here for screening and treatment and everything.
Like HIV, the mode of transmission of Hep C is almost common, like unsafe syringes, razors, blades, or piercing or tattooing.
We have the model of care where we require very few consultations and very few diagnostic tests and follow-up, so that the patients don't have to come here and then they complete the course of treatment effectively.
बहुत तरह के लोग आते हैं हमारे पास, गांव से अधिक लोग आते हैं, तो उनसे हम उनके व्यू पूछते हैं तो वो हमें बताते हैं ये खाने से होता है, ये पीने से होता है, और ये एक दूसरे से बात करने सांस से होता है, तो वो सब नहीं है। हमें इसीलिए उन्हें जागरूक करना है कि हमें उन्हें बताना है कि ये बीमारी इन चीज़ों से नहीं होती है। ये बीमारी जो है ये ब्लड बोर्न बीमारी है, ये खून से फैलती है।
Situation was that there were already so many patients who were detected with Hep C and who did not have treatment till now. As a result, we have about more than 2,500 patients who are still waiting to be tested and treated in our program. The future of the program, we are expecting the state government, the central government will soon initiate a hepatitis C program. Once that happens, MSF will try to demonstrate a community-based model that is a further decentralized model of care in the community.
There are women who are not able to get married because they have Hep C. There are young boys who want to go out of the country and start a business, but they are not getting visa because of Hep C. Hep C is not just about this disease that they have. Their lives are at stake because of this. When the patient is cured, we give the certificate which says like this is your name, you're from this village, and from today you don't have Hep C anymore. So for me that is the biggest achievement, the day when I can give this to the patient.
The MSF Scientific Days highlighted truly people-centered approach, as you see, and with a lot of innovations focusing on providing world-class healthcare to the communities that we serve, of course. For today's collaborative effort, I thank our audiences, presenters, poster authors, editorial members, steering committee, volunteers, coordinator, and forgive me if I miss anyone. The branch office has done a great job, led by the General Director. My special congratulations to Peter Paul. A special thanks to Prince Matthew for running the program on schedule and for the interesting introductions. I cannot thank enough the one person whose untiring efforts brought all this together, Holly Jane Baker. There she is. And from the SARA board, I have a message to share with you. Our accountability to patients needs to improve all the time. These scientific days need to be a tool to make a better healthcare delivery. And I hope that in the succeeding scientific days, we will have presentations which highlight the social impact we create with our missions. Thank you so much.
Thank you, everyone. I just want to conclude with a few comments. So, like Dr. Chanjiv said, I just want to take this opportunity to thank all those of you who attended today's session. We had about 170 people turn up today at the venue today. We had about 550 people from India, from the US, UK, Pakistan, Bangladesh, Ukraine, Australia, Canada, Jordan, Yemen, Philippines, Turkey, Peru, and a number of other countries who joined in on the online audience. So a significantly large online presence, people who turned up to watch the live stream. Thank you all who attended that. Also a special thank you to the chairs, the presenters, the poster authors, the keynotes, the editorial committee, Holly, and all of the others who worked. And I want to give a special thank you to the comms and the IT team who worked really tirelessly. Guys, if you're here, could you please stand up? I think you guys deserve a really good round of applause for all the work that you guys have put in. Perfect. So the videos of the conference will be online in the following weeks. So if you want to share some of these presentations, if you want to use some of this for your scientific discussions or things like that, that would be perfect, and it should be online in about a couple of weeks from now. Just a reminder that I spoke before about the Mapathon and the Innovation Day that's happening tomorrow. Both very exciting events. If you want to attend, please register online on the MSF India page. We're also going to have a small tea session after this, so everybody who is interested, please stay back for some refreshments. So I will close here. Thank you so much. We had an amazing day, very interesting discussions, and hope you have an interesting evening ahead. Thank you.